Hi. Okay. Let's give it 1 minute and then we'll start because, as you know, I have a lot of information. I got to talk really fast to get through this. Here, let me put the slides up. Ooh, people joining. Yay.
Recording, yay.
Can you see the slides, everybody?
Yep. Yep.
Okay. All right. Okay. But yeah, now I can't see people anymore. So do you want to go ahead and tell me when to start?
Sorry, I was muted. We have 11 people on, and I think you're ready to go.
Okay. So welcome everybody to our training program for the 2025 Twin Cities Pride Festival in Minneapolis. After all the planning, we applied for this in January and now it's here. But thank you so much for volunteering. This event is meant to be a celebration for members of the LGBTQIA+ community who have historically faced discrimination, harassment, marginalization from almost every institution in our society. For anyone who doesn't know the history of this movement, Pride started in recognition of the Stonewall riots, a series of protests in response to a police raid that began in the early morning of June 28th, 1969, at the Stonewall Inn in Greenwich Village, a part of Lower Manhattan in New York City. The first gay pride parade in Minneapolis was a march and a picnic in 1972, and it has grown to the event that you will experience this weekend, which is the second largest event in the state of Minnesota after the state fair. My name is Ann Jones. I'm Vice Chair of Healthcare for All Minnesota and Chair of the Organizing and Base Building Committee, which is responsible for bringing more people into this movement. We have a serious purpose for being at this event, but I want to encourage you to enjoy it also. Maybe come early or stay late, visit some of the other vendors. Most of our conversations with people will be brief, as you will see. People just kind of are streaming by on the sidewalk past all the vendors, and we're right next to each other. There's hundreds of us, but some of the conversations will require you to have enough background to answer questions and maybe get some of our contacts to take next steps. This training is meant to give you the information you need to participate in this event and to give good information to those who take the time to talk to us. I have a lot to present. It'll be kind of a information for volunteers and a crash course in health policy. So I do go a little bit over an hour. I hope just everyone stay as long as you can. We will provide a video of this event also if you want to review, and then if I remember, I will copy the slides and bring them to the site. But we also have a lot of printed material to help you with information for people who talk to us. So 2025 Pride Festival is Saturday and Sunday, June 28th and 29th. It's 10 a.m. to 7 p.m. on Saturday, 10 a.m. to 6 p.m. on Sunday. I thank you to those who have offered to help me set up on Saturday and those who have offered to help me tear down on Sunday. The theme for this year's event is Live Proud. The button we're giving out again this year includes the transgender colors and the black and brown stripes for persons of color. We have added a petition this year, and we will be collecting signatures for universal single-payer healthcare system, along with a handout with information asking festival goers to help protect Medicaid, which, as you'd have to be sleeping under a rock to not realize that Medicaid's under threat as a result of this continuing resolution budget fight at the federal level. The location of our booth is in the blue section, which is the lower right section of the map, the southeast corner of Loring Park. We are blue 80 this year. It's a few spots east of the purple section. And I've got my cursor over the area where those numbers are really, really tiny, but I believe this is about where we are. So this is the general layout of the booth. We will have a cover, a blue tent to cover from sun and weather. We'll have a big banner in the back. We have a table. We'll have some materials out on the table and buttons, business cards, social media, QR codes, etc. I'll give you a little bit more information when you get there. We generally try to be out in front, as this picture shows,
Yeah,
to
Ann,
catch the people
Ann,
walking by.
can you go back to that map for just a minute?
Sure,
Yeah, that's better. Okay.
it's the same spot that we've been. It varies. We're somewhere between booth number 80 or 90 this year. It's
Okay.
booth number 80, so it's
And-
roughly the same spot.
Sorry to interrupt. Are you able to zoom in so people can see where you're pointing?
What? Me? Zoom? I don't know that I can.
Is there a way? I was just curious because it's kind of small on the screen.
Oh yeah, I know.
Yeah.
I don't know if I can do that actually.
No
Zoom,
worries.
and I don't know that I know how to do that with these slides. Can you see my cursor
Yeah.
here? So Lindale is over here. If you know where Lindale is, those big downtown churches are on the corner of Lindale and West 15th. So this site, Loring Park, is just off 94 and Lindale. The cathedral is to the north. Minneapolis College is to the north. We're kind of in the middle of the park on West 15th Street. There is two-way traffic on West 15th, and I'll talk a little bit about parking with another slide. So like this picture shows, we generally try to be out front to catch people walking by. This year we will want to direct people to our table for the petition. And we decided to go back to having something that people could sign, even though we're using QR codes for contact information, because people do like to have an action that they can do. A lot of people have asked if we have a petition or anything, so we went ahead and created one this year. Just miscellaneous information for volunteers, like I said, will be under an open tent with tables, written materials, buttons, business cards for both Healthcare for All Minnesota and Physicians for a National Health Program Minnesota. You can wear an organizational t-shirt or clothing and accessories that celebrate the Pride Festival. If you have a t-shirt, go ahead and wear it. We have not purchased new ones for quite a while, so I'll bring some, but the sizes are really, really big, so don't count on getting one from me. Our goals are to have some good conversations, build our base of support for reform, grow our social media following it, and increase awareness of the Minnesota Health Plan. So we'll have clipboards, pens, QR codes, and a phone, which includes a phone app for contact information. And also, I think I have a poster that says what healthcare means to me. I have another poster that says somewhere under the rainbow, everybody has healthcare. I'll bring some sticky notes, and we might have an activity where people can write down what having healthcare, reliable, affordable healthcare would mean to them. New this year is the MHP petition on clipboards, plus information on threats to Medicaid. So we build political power by increasing our numbers, but also developing relationships helps us increase engagement of the public with this issue. Our database requires at a minimum first name, last name, zip code, and email address. The reason that QR code is helpful is because it just asks for everything, and a lot of people's phones will just auto-populate. But when the festival gets really, really busy, it's hard for people to pull up the QR codes because the towers are just jammed. So in that case, the petition, I think, will be helpful for us to have people give us their contact information on paper. It just is kind of a data entry challenge, and handwriting is tough to read. So, to help people make sure that it's clear. So a complete street address and phone number is extremely helpful. We communicate almost exclusively by email because it's less expensive and a lot faster, but phone banking is more possible going forward. We're going to be doing some fundraising phone banking, and we may be doing some outreach and turnout by phone banks also. So the QR code does help us reduce the data entry burden, improves accuracy, and also it gets people in the database immediately. So phones are working, do try that. This is the roster. of volunteers. Check and make sure that you are where you think you are. I tried really hard to be accurate, but I'll have this at the fair or at the festival, and I have phone numbers for everybody, and you'll have my phone number also. We'll send this out to everybody. My phone number is there in case you are needing help to get where, to our location. You can always give me a call. Also, I have some information for volunteers at the top of this, like it's very helpful. You have the shift times, but we need people to come a little bit early, and you might have to stay a little bit over. Just like any shift, you have overlap. You have people coming and going, and we need to give people a little orientation to the booth. So try to be there in time to get some information before you actually start talking to people. The Saturday morning includes setup, and I do have some volunteers. Let's see, I put that. If your name has a star by it, I've talked to you about volunteering to help set up on Saturday morning, and then volunteering to help tear down on Sunday evening. But we do have to kind of close up on Saturday afternoon, so that takes a little bit of time. We lower the tent, put all the paper away, cover everything to make sure that we protect our materials from rain and moisture. And then it takes time to set up on Sunday morning. So I get there early, but it's helpful if a few people can come early on Sunday so we can get set up again. So parking can be a challenge. Consider being dropped off or taking public transportation, but parking includes the church lots across from West 15th on Saturday. On Sunday, it's harder. They have church services and they don't really want us in their parking lot. So then the Walker Art Center has a parking garage, and that's across Lindale. Also the ramp for the Minneapolis College. And sometimes street parking is available. I think I said wear the t-shirt for your organization if you have it. And again, no guarantee on sizes. Or if you have a rainbow t-shirt or a scarf or other gear, go for it because it's a festival. Please bring water, snacks, whatever you think you need to stay comfortable. Possibly a rain jacket if it's Sunday. It's cool in the morning, so you might need a jacket. And wear sunscreen. We are out we are out on the sidewalk, so you are out in the sun. Saturday is supposed to be sunny, maybe Sunday. So check the weather for the weekend. It keeps changing. Saturday's been looking reliably good. Sunday's a little bit more iffy. So anyway, so other hints, we all need to be we're smart enough to know that we have to be fully immunized for communicable diseases. We're talking to a lot of people face to face, and please be sure that you are well with no symptoms of any communicable infections and up to date. Hopefully we're all it's not too late to say that. Parking can be difficult again. Water and snacks. Okay, I think I've gone over all that. I've got a printed schedule of activities for the 2025 Pride Festival that I'll have in the booth in case you have time to spend other time at the festival. For safety, the event coordinates a comprehensive all hazard safety plan. There are a lot of people at this event. They have a security team, medical services, law enforcement, traffic control, and emergency management throughout the festival. If we have if something happens at our space, we have a phone number to call. For emergencies needs, it's a 911 call if a serious medical emergency happens. We have had some things happen at our booth, oddly. One time a cart with like those little golf carts with people that run around the festival was trying to go behind the tents along our location, and it tipped over and people fell out of the cart. We had somebody fall in front of our tent, need to elevate their ankle, and we had to call dispatch. And then there is you can put a number on your phone for a notification of anything going on at the event. Our meetup spot is, as a volunteer, is our vendor location, which is B80. We write down emergency contacts and have them with you and let somebody know where you are. We are asked to report any violence, threats, or any incidents of hateful behavior or speech, unattended bags or suspicious activity or drones. It's just like any other big event where there are a lot of people involved. Common sense safety is in order. There is also a Twin Cities Pride Code of Conduct, which includes these considerations: respect, integrity, safety, commitment to education, collaboration and community engagement, environmental responsibility, and consequences of unacceptable behavior. So there are plenty of trash cans available for us to keep the park neat. I am confident that all of our volunteers are participating for the right reasons, but they have a printed code of conduct as well. So this is kind of a look. This is just generally where we are. If you know the sort of the layout of the park, on West 15th Street, there are apartment buildings. There's a church on the corner of Lyndale and West 15th. And there's a Dunn Brothers Coffee. We're sort of down the hill from the Dunn Brothers Coffee. I don't know which way, east or west, but if that gives you a little bit of a landmark if you're walking toward the park. And then there are entrances at all corners of the park. So you just come down the sidewalk and you'll find us. So we have, you can see that we have a tent for cover, but we try to be out in front so that we're approachable. You can have brochures and business cards in hand. And again, I mentioned the petition. So we are going to want to direct people to the table. So we'll probably have one or two people sitting behind the table to provide materials. If you're wondering how do I start? This is kind of a challenging subject to talk about sometimes. I find that if somebody approaches you at the table or makes eye contact at an event like this, the best opening line is something really simple, like, would you like to help us fix how we pay for healthcare? Or do you have any concerns about your healthcare? If they ask you, what is Healthcare for All Minnesota or Physicians for a National Health Program Minnesota, the easiest answer is we are a nonprofit, nonpartisan advocacy groups working to fix how we pay for healthcare, starting in Minnesota and moving to a national health plan. Single payer, improved and expanded Medicare for all. Our trifold brochure on the Minnesota Health Plan is a good handout. And also feel free to give out business cards, and more than one is fine, because I tell people, be an organizer, hand them out to your friends. It's got a contact information on the front, our website, a phone number. On the back is a QR code for getting on our mailing list. You can use a handout that we call the one-page summary, which is a statement of purpose, and walk through some basic talking points if people are willing to stand or stay and engage with you any more than just a few minutes. And then our job is to organize, educate, organize, and legislate. The mission statement is at the bottom of the page. And on the back, I've printed a sort of a to-do list, and it's called a commitment to act, with a bunch of stuff that people can do. If they want to know, what can I do right now? I mean, the first thing they can do is get on our mailing list. And then after that, start talking to their friends and family, learn more. And we have lots and lots of information and ways to do that, and other actions people can take. So answer questions, offer additional information, share what we have coming up for educational events. I'm going to print something up about upcoming events. And then again, the MHP petition. We're going to take several months and collect signatures is kind of our thought right now, and see how much support we can, evidence of support for the Minnesota Health Plan that we can get between now and the next legislative session coming up in 2026. Also ask for a follow, a like, share, and follow on Facebook, Instagram, and now Blue Sky. We are on Blue Sky. And then they can do, for another activity, they can make some comments on a poster, whichever one I happen to bring, right? So what do I say when, if things, if you get kind of difficult questions or comments, try to do things like reframe a statement that is not going in the direction we need people to go to fix how we pay for healthcare. We also have a handout that's called Frequently Asked Questions. It's 10, I think it's 10, one page, things people often ask about the Minnesota Health Plan or a single payer system. And that's very easy to give people, and it will answer most of the most commonly asked questions. I can share that with you when you get to our booth. But also make sure that there's no confusion about selling insurance versus reforming the whole system. We are not here to sell insurance, but some people do ask, can you help? I need insurance. I don't have anything. What do I do? So what we do is just refer them to the exchange for the Affordable Care Act. And I have cards with a phone number on, but the phone number is right here on the slide. The Affordable Care Act Insurance Exchange in Minnesota is MNCHR, and that's how people's eligibility, if they do not have employer-sponsored insurance or not on a public program like Medicare, Medicaid, children's health insurance already, and they're looking for something in the individual or small group market, this is where they have to go. And then obviously Minnesota Care and Medical Assistance are options via the exchange, but people have to go through an eligibility determination. If people need help right now for some, healthcare concern, there are booths also for Rainbow Health and Planned Parenthood are usually vendors at this event. So we are advocating healthcare payment reform. We are not selling insurance. Also, if people call this government-run healthcare, we reframe and refer to this Healthcare for All Minnesota or Minnesota Health Plan and Medicare for All as government-financed and government-administered healthcare, not government-run, because the actual facilities and places they would seek healthcare are would remain basically the same. We would still have Allina Health, Health Partners, Regions Hospital, CentraCare in St. Cloud, Essentia, Mayo Health System, Fairview Health System, Health, that kind of thing, or their own clinic. People that you'd still have the system, the delivery system remains approximately the same, although probably more efficient. What we're talking about is fixing how we pay for healthcare and how we administer the system. And if people ask you, well, isn't this, socialized healthcare? In my mind, I say, well, social is people. And yes, the healthcare system should be for people. But we reframe that by saying that, what we're talking about is no longer propping up a multi-million-dollar commercial health insurance industry with taxpayer subsidies and wasting money on administrative costs, but actually creating a system that goes directly into actual healthcare. So we advocate choice of doctors, hospitals, not choice of commercial insurance policies, and competition should be about competing for your business because of the quality of their service. And if somebody says, well, I don't think anything's free, or I don't believe in that free stuff. I don't know how much of this you'll get at the Pride Festival, but you do. You get, there's so many people going through, you get people with all kinds of, attitudes and preset ideas. And if somebody refers to this as free, obviously we can say nothing's free. What we're talking about is prepaid via tax revenue or premiums if we're talking a state-based system, but free at the point of care to remove the barriers of cost to getting the care you need. So there's lots of talking points on the frequently asked questions and other materials. This is a look at the petition. It's just a piece, a paper with, lines and boxes. We need a name and a signature on the left, and then their contact information. There's room for notes over on the right. And what we're asking people to sign and support is is a statement that says, we, the undersigned, call on Minnesota state legislators and the governor to pass and implement a publicly funded and administered single-payer healthcare system that guarantees comprehensive coverage for all Minnesota residents, regardless of income, immigration status, or gender identity. Coverage includes full reproductive services and gender-affirming care, and addresses the issues of cost, quality, and access to health care to reduce racial health disparities. So pretty straightforward, pretty simple system. And this is almost an elevator speech for what we're advocating. So, and then also kind of unique to this year, one of our indivisible groups in Minnesota has prepared a little handout that asks people to take some action to protect Medicaid, because Medicaid is seriously under threat at the federal level. And it's a little handout that explains what the impact would be for people who would lose coverage. And I have a supply of these, and it wouldn't hurt to remind people that while many members of the LGBTQI plus community rely on Medicaid medical assistance in Minnesota, loss of public funds for Medicaid and Medicare threaten the healthcare system for everyone. When hospitals and nursing homes close, that harms everyone in the communities they serve, not just the people who are actually receiving those benefits. And that affects the economy of the local area as well, because hospitals and nursing homes are big employers, especially in smaller communities. So if people don't think of that, feel free to remind them that, we're all in this together. This harms everybody. So I've got some basics about our current system. I call this kind of a crash course in health policy. So this is going to give you a good grounding on the issues of cost, quality, and access to healthcare under our current system. We have the basic concepts about our current system is that we vastly overpay for healthcare in the US, not because we get better care than everyone else in the developed world, but because of the waste, inefficiency, and complexity in our multi-payer system. We're not getting our money's worth. We're leaving far too many people out. We do not need to come up with a lot of new money to fix this. This is not another program that layers another expense. We are going to replace the money we're spending, redirect the money we're currently spending into something that resembles more efficient and more money going into direct patient care. There's more than enough to go around if we're willing to reimagine how we organize and pay for healthcare and public services. We already know how to fix this, and the solution is fairly simple. You've probably seen a Facebook post that goes something like, healthcare is such a complex beast that only 32 out of 33 developed countries have figured it out. So the question is not how to fix it. The question is what is stopping us, and continuing with small fixes, tinkering around the margins will not work. And these talking points are right on our one-page handout. So you don't need to memorize them. You can just show people the handout and just kind of point out, here's where our money's going. And I put in bold the two things that people really need to understand. Under our current multi-payer system, 34 cents out of every healthcare dollar is spent on non-healthcare activities, the administrative costs of a multi-payer system. And 2/3 of health spending is already taxpayer funded through Medicare, Medicaid, Children's Health Insurance Plan, federally qualified health centers, the Indian Health Service, the Department of Defense, the VA, county hospitals, plus subsidies for employer-sponsored insurance and plans on the exchanges. Both of these are massively publicly subsidized. So it's really not a market system at all, other than the profiteering that goes on, because these industries cannot stand alone without massive taxpayer subsidies to make them work. So all of this stuff is on our one pager. Our job as honest brokers for fixing how we pay for healthcare is to be able to explain what's wrong, why incremental measures have not worked, why we need definitive structural change. So I just kind of find it's helpful to have this stuff ready when I'm talking to somebody to show and tell. it helps people retain information a little bit more. So, see, there's some of the reference materials we have available, handouts like the one pager I mentioned, the commitment to act I printed on the back, threats to Medicare with a call to action. We're really trying to explain to people that Advantage plans are draining the Medicare trust fund. So that's another whole educational effort, you know, in addition to threats to Medicaid. Got a handout on the rural health crisis. There's something called single payer, what it is and what it's not. I've got some literature in a plastic box if you need to look for it. Frequently asked questions is a really useful tool for the things that people ask often. The petition and then threats to Medicaid. Okay, these are the big numbers. We've got an industry that consumes almost a sixth of a huge multi-trillion-dollar economy. And yet 29 million people are uninsured under even, you know, how many years after the Affordable Care Act passed, and 41 million are underinsured, meaning they can't afford to use the care that they pay for because of the copays and the deductibles and the point of care costs. Total health spending is 4.9 trillion. That's as of 2023, which is, you're always 2 years behind when Centers for Medicare and Medicaid Services comes up with the big number. 14,570 per person. And then health spending in Minnesota, I need a newer number and I haven't been able to find it, but it's projected to double in 10 years if we do nothing. So, as you can see, total health spending is a much higher proportion of gross domestic product in the US than any other of these high income countries. We spend 2 to 3 times the amount per person of any developed country, and our health outcomes, you know, general health of the population, are much lower. Most developed countries, we all started out about the same, you know, in the post-war era. And then we started diverging in the 80s, 90s, and 2000s as other countries chose systems that would be more more comprehensive, with a little more, I guess, control by the government. Most of these countries went in the direction of some kind of national health system, either publicly funded, publicly insured, or at least highly regulated, with the government stepping in for the uninsured. So I talked about outcomes a little bit. US ranks 37th overall, according to the Commonwealth Fund, which studies this every year, puts out a big report every 2 years. We are the outlier. Our health outcomes are much worse. Our incidence of chronic illness is higher. Life expectancy is lower. Infant mortality rate is higher. There's just no real way to justify the amount of money we spend and the health outcomes we get for our population. This mess is how we currently finance healthcare in the US. This is why we are called a multi-payer system. We've got this, you know, post-World War II private health insurance employer-sponsored system, which is kind of our basic model. People think that most people have employer-sponsored insurance. That's actually really not true anymore. The public insurance plans cover a lot of people. Just, you know, a point about Medicaid. Medicaid is not a charity. Medicaid is the insurance coverage for 73 million people in this country, 1 in 5. And that's that rate is even higher in some lower income states, but it's about 1 in 5 across the country. And that is rural, urban, and suburban. Then we have the public programs. In Minnesota, approximately 70% of Medicaid goes to nursing home costs. And that doesn't go by political party. That's everyone who runs out of, you know, private pay funds winds up requesting a public support. The Children's Health Insurance Program has been in place since the 90s. Federally qualified health centers. These are clinics. So we have, I think, 18, maybe a few more in Minnesota, but 1,100 around the country. This is a huge part of our health system that most people don't know a lot about, but they take care of a lot of lower income persons, the homeless, undocumented persons on Medicaid, medical assistance. We have a U.S. Public Health Service is this system supposedly for the Indian Health Services, but a lot of Native Americans also are on Medicaid. We also have emergency medical services that we fund, emergency rooms, county hospitals, university hospitals, critical access hospitals in rural areas are important for rural America and rural Minnesota. Medical or motor vehicle insurance pays for some health care, got Social Security disability. In Minnesota, we have Minnesota Care. We're one of 2 states, Minnesota and New York, that have kind of a quasi-public system for lower income working people. And then there's private pay, including deductibles and copay. So all of this is called our multi-payer system. You can imagine how many moving parts and the administrative burden. So this really shows you that, why a third of the money we spend goes to the administrative side of our system. Okay. Anyway, it's a patchwork and it's costing us a fortune. And it isn't as though we haven't tried to contain costs. This thing is the alphabet soup of cost containment strategies tried over the last 45 years for PPOs, HMOs, DRGs, ISPs, ACOs, preferred provider organizations. Everybody knows about health maintenance organizations. Kind of started in Minnesota and kind of spread around the country. So we got that going for us. We created some of this problem. It started in the Nixon era. This is all based on the belief that Americans overuse healthcare and that making it harder to get will sort of reduce costs, and that fee for service is the culprit. Those greedy doctors are just ordering too much stuff, and that some sort of capitation scheme will work, or that if you would become a better shopper, healthcare costs would go down. It doesn't work. Costs have just continued to go up, and it has created an enormous administrative burden for doctors, healthcare providers, hospitals, with and patients and families, with requirements for pre-authorizations, with denials, with delays, and with outright refusal to pay. So that's why, I mean, there's lots of good reasons for working on fixing how we pay for healthcare. If we have the best healthcare system in the world, which is a common phrase that you will hear from the opposition, then why is it that 1 in 5 people can't afford to get, 1 in 4 people can't get the care they need due to cost? 1 in 5 people can't go to the dentist. We have thousands of preventable deaths every year due to lack of access. 2/3 of personal bankruptcies are due to medical debt. People carry, we're in the billions of dollars in medical debt in this country. That just simply doesn't exist in other countries. It's one of the biggest reasons that people lose their homes and their businesses. 42% of people with the diagnosis of cancer deplete their savings within 2 years. Why would we burden people with a devastating disease and then put them in financial distress as well? So the basic concept is that health insurance tied to a job is unstable, insecure, costly, disruptive, often leads to gaps in coverage, which is terrible for people with chronic diseases, and requires massive taxpayer subsidies to work. And treating healthcare as a business serves corporate interests, but not the people. So information specifically about the communities we are hoping to engage this weekend. The LGBTQIA community faces an array of discriminatory barriers, including a healthcare system that lacks caregivers trained in their needs. Also, the cost of hormonal therapy for transgender individuals, the cost of HIV/AIDS medications, preventive therapies, and surgical procedures are not always covered, even with health insurance. Young people especially experience a higher than average rate of mental health needs. LGBTQIA plus high school students are 5 times as likely to attempt suicide as their heterosexual peers. And then cost, quality, and access to healthcare is a top concern for members of this community, including mental health services. Other barriers include the fact that members of this community are more likely to be unemployed or experience job instability for a variety of reasons. A system of healthcare financing and coverage that ties insurance to a job is obviously a barrier to coverage for many in this community. They're also more likely to experience unstable housing, unreliable income, lack of social supports, and more likely to be uninsured or underinsured or face gaps in coverage. A state-based plan such as the Minnesota Health Plan, or better yet, Medicare for All, would offer the health security they need. These are a couple of resources if people are interested in learning more about gender identity and pronouns. And then there is a video that was recommended by the Pride Festival last year. Hopefully that this link will still work and contains slides for information for those of us who are volunteering. And then I have a gender glossary handout in my literature box also, if you need to refer to something. In going back to 2023, when there was huge fights about gender affirming care around the country, Minnesota, with our with the political party in the constitutional offices and in the State House and State Senate, passed a lot of legislation that was really positive for the LGBTQIA plus community, including legislation related to gender affirming care, banning conversion therapy, protecting reproductive and gender, I said that, making Minnesota a sanctuary state for individuals and their families seeking gender affirming care, and prohibiting courts or state officials for complying with child removal requests, extraditions, arrests, or subpoenas related to gender affirming healthcare received in Minnesota. Sounds really scary. And all of that did pass in 2023, still is in place. And Minnesota is kind of a beacon of hope for people whose states are continuing to pass more and more restrictive measures for this community. So these are important. The information that we want to provide is that while healthcare for members of this community would be legal in Minnesota, that doesn't make it affordable or accessible. So that's what we're talking about with our reforming how we pay for healthcare. So our goal is a payment system that would actually cover. And the public option line, I meant to take that out, doesn't apply anymore. That did not pass in 2024. So what's the fix? What are we fighting for? We are on a dual track toward a national health plan. We all agree, everyone in the single payer movement at state-based agrees that a national health plan would be better, more efficient, more cost-effective. But 21 states are working on state-based plans because it's just really hard to get things done at the national level. So the Minnesota Health Plan was reintroduced in 2025. These are the bill numbers. No hearings were have been held yet. We are working on, and we want to ask people who we talk to, when they say, what can I do? Say, talk to your legislators about getting hearings on the Minnesota Health Plan. That's the purpose of the petition, but also, I encourage people to get to know who their legislators are and ask for hearings. Also, just so you know, this would require enabling legislation at the federal level, and that bill called the State-Based Universal Healthcare Act is being reintroduced, we believe, in July this year, sponsored by Ro Khanna in the House and Senator Markey in the Senate. So many people are familiar with the Canadian system, where their system started in one province and then expanded across the country. The same year that we passed the Medicare and Medicaid Act of 1965, the Canadian healthcare system started a Medicare for All in Canada. The new Medicare for All Act on the federal level was of 2025 was reintroduced on April 29th, 2025 in Washington, D.C., in the House by Representative Pramila Jayapal and Representative Debbie Dingle, and in the Senate by Senator Bernie Sanders. I do have new bill numbers posted, and as you can see, a national health plan would be best for funding reasons and efficiency. The state plan would require premiums based on ability to pay, plus we'd have to try to get this federal money that's currently coming into the state for things like Medicaid. That's what the State-Based Universal Health Care Act is all about. At the federal level, they're talking about a system that relies on federal, on our tax code. Something like a payroll tax that we are already accustomed to paying, but just increasing it enough to cover everybody. And then a couple other sources of funding like capital gains tax and wealth tax. So the Indian Health Service and the VA health system would remain as is. But a lot of people who access Indian Health Services and VA health system also access the rest of our healthcare system. So it would be kind of both. Neither of our in Minnesota, Representative Omar and Representative McCollum are co-sponsors on the House bill. So we have work to do. We certainly ought to be able to get CD3 Senator or Representative Kelly Morrison. And a lot of us have talked to Angie Craig in CD2. Both of them need a lot of public push. Neither of our U.S. senators are on the Senate bill, not for lack of trying. A lot of us have called, but keep calling, because there's no reason that our senators wouldn't be co-sponsors on this bill, especially Senator Tina Smith. She advocates or emphasizes that rural health is one of her big policy concerns. Well, there's nothing that would be better for the rural health care than the Minnesota Health Plan. Senator Marty emphasizes that these principles would be specified in law and govern the system and would be legally binding on the board of the Minnesota Health Plan. So lots of emphasis on comprehensive coverage, including dental care and long-term care, choice of providers, no networks, cutting costs by cutting administrative waste, not by denying care, premiums based on ability to pay, preventive care, continuing Minnesota's leadership in medical education, research, and technology, adequate and timely payments to providers, global budgets to reduce the cost of running hospitals and other facilities, simple payment system, and provisions for workforce development, including a just transition from the current system to a Minnesota health plan. So it's really good. So Senator Marty not only wrote the bill, but he wrote a book. And I have lots of copies of this book. I do have to buy them, so I ask people to give me a little reimbursement. We cannot take any money at this festival, by the way. I will have a few books available. And if you think you're talking to somebody who really, really, really will read the book, go ahead and let them, give them a copy. I'll have a few at our booth, and I on some occasions just give a copy away and ask them to make a contribution to Healthcare for All Minnesota, because we're not allowed to take any money for anything. So anyway, it's really good. 140 pages. If you haven't read it, please consider reading it, and you'll feel like you really know what you're talking about. It talks about the rationale, the principles, some of the political considerations to getting it passed, and a little bit about financing. There is a cost analysis bill that did get funded in 2023 that will be due to be reported out in early 2026 on a single payer system for Minnesota. We are looking forward to that report, as well as a report on the administrative costs of these managed care administrative system for our public programs. A lot of people don't know that Medicaid benefits are accessed by people having to use one of our health insurance companies, and that adds an administrative burden and barrier. So the Medicare for All Act of 2025, again, very comprehensive, similar emphasis, comprehensive benefit set choice, removing financial barriers to care, no co-pays, deductibles, or coinsurance, single standard of care for everyone. If anybody asks you, by the way, well, wouldn't people be able to buy their own if they wanted something better? We say, no, this is going to be the best system for everybody. It will be fair. It will be equitable. And no, we don't want people jumping the line and buying something, in addition. And people, there will not be private health insurance industry if we pass a Medicare for all. So we want the best care for everybody. We don't want, a two-tiered system. We'll save money by having hospitals submit requests for a budget, not billing for every Band-Aid and aspirin. There will be standardized fees for physicians, standardized fees for drugs and devices, bulk purchasing, targeted funding for rural hospitals and underserved populations, transition that protects workers, safe staffing. VA and Indian health system are preserved as is. And on the national level, requirements for planning for natural disasters, epidemics, and pandemics. Just really, if you've never read, I've read lots of pieces of legislation. I thought this one was the most well-written, the most easy to understand. 140 pages, actually not at all hard to read, and you'll be reassured that it is very comprehensive. So if you're talking to someone who asks, well, so how are you going to pay for all that? The simple answer is there's already enough money to go around if we just reimagine how we organize and pay for healthcare and public health services. Even people who are with us are sometimes afraid of the cost because they've been told by those who are opposed to reform over and over that we can't afford it. The answer to the question is that there's enough money to go around, and that taxpayers, the public, already fund numerous public programs that fill the gaps in coverage left by employer-sponsored private insurance. So not including the subsidies that these companies and employers receive for offering insurance. So in Minnesota, costs are expected to skyrocket over the next few years if we do nothing. You might always also run into the strongly held belief that Americans don't want government-run healthcare. So I don't know how to help people understand that we have excellent healthcare services already being provided at places like our VA health system, at our county hospitals, at our university hospitals, at the National Institutes of Health. We have numerous examples of excellent publicly funded, publicly administered facilities in this country. But a good response for that is that under a single payer system or a Medicare for all financing system, the government is the payer, not the provider. So people working in these systems will work for the whatever system you work for. When I was University of Minnesota, of course, the University of Minnesota was a state-based or state-run and financed system. Our Hennepin County Medical Center is a county hospital. The VA health system, by the way, gets better marks than their civilian counterparts on cost, quality, and access to healthcare, despite what anybody might tell you. They consistently rate very high. And veterans I've talked to love the VA. Our VA Medical Center in Minnesota is an excellent institution. So with the exception of already publicly run systems like the VA, the Indian Health Services, military medical system, county hospitals, and FQHCs, the delivery system will look approximately the way it does now. So, and there is lots of information out about funding the system. But when somebody gives you a scare tactic, like, that Bernie Sanders thing would cost $34 trillion. It's going to cost that much anyway, and that's over 10 years. And it's going to cost more if we don't do anything. So this is just a little bit more about cost and covering how we reform, but just one piece of our current system, that administrative cost, that 34%, we could save 34% of 4.9 trillion is almost 1.7 billion in spending on just administrative costs. The estimates are that we could save at least half of that, or 800 billion. And that's a lot of money, and that's annually, that we could put toward covering everyone and improving services. We could increase the FICA tax that we already pay for Medicare, but only actually fairly modestly. And if you talk to small business owners, they will tell you this would be a huge savings for them, even if they had to pay both sides in comparison to what they're already spending, even if they only try to cover their own families. We could also tax unearned income, capital gains, and wealth. I think I already said that. So now about us and you and who are the people we're talking to. Fixing how we pay for healthcare is going to require a lot of grassroots support. We asked for contact information from potential advocates so that we can stay in touch with them. You can mention that we send out monthly newsletters, notices of volunteer opportunities, educational events, occasional calls to action. Please encourage people to open the newsletter because it's got a lot of information, and it's only once a month, and to look for ways to participate and share events. Also, ask them to be an activist, even if it's only 1 or 2 or 3 actions from that to-do list on the back of the one pager. People are going to turn public opinion into political will. My rep, Jim Davney, for many, many years, gave us a talk at our local group when we had some local groups going, and he said, we all have to be pushed. You have to create the political, you have to make me do it. So we need the people power. We need candidates and office holders who will champion and run on change, but we also have to kind of be the wind at their back, and also the pebble in your shoe to make sure that they don't forget that we need to get this done. So as advocates, we want to develop a relationship with our elected officials and be seen as trusted sources of information on healthcare financing and system reform. So I'm really big on people knowing what we're talking about and being trusted messengers for our cause. So we're out talking to the public this weekend to create more of us. More people who are informed and who will take action to demand change. This is a list of ways that activists and ordinary people can help us build this movement. Healthcare for All Minnesota and Physicians for a National Health Fund are actively seeking organizational partners for this work. We need a lot of coalition partners. Neither of us are going to be able to do this on our own. So we need a lot of like-minded organizations in addition to our individual advocates and activists to build that political will to influence a change that this significance at the Capitol. We had a very successful lobby day in 2025, and we're going to build on that with another day on the Hill in 2026. We will be supporting legislation to get the commercial insurance industry, including the health maintenance organizations, the managed care organizations, out of our public insurance programs, Medicaid and Minnesota Care. This will reduce wasteful administrative costs and redirect resources to the part of the healthcare system actually providing healthcare, which are doctors and other providers, hospitals and clinics. And just a little bit about election 2026, which I know all of us are thinking about. We have a critically important election coming up, a big one. This election may very well determine whether or not we remain a liberal, secular, constitutional republic. And elections always matter, but this one is huge. And I thought 2024 was important. I thought 2022 was critical. This one is just really important. It'll tell us what direction we're going in this country. We only have to look at 2016 and 2024, the presidential elections, and then the attorney general race here in Minnesota in 18 and 22. If they had turned out differently, we would be a very different state. I mean, and it was close. And a lot of people really worked hard to get Keith Ellison reelected. The 2020 contest gave us a Democratic president and majorities in both chambers in the Congress. And then the 2022 cycle here in Minnesota gave us a governing DFL trifecta. Now, we are a nonpartisan organization, but so far we haven't managed to get any Republicans to join us in this fight. So I guess I'll just have to talk about the Democrats and the DFL. And then we reelected an attorney general who actually cares about consumers. The 2024 cycle just had huge implications for the presidency and the Congress, but also the Supreme Court. In Minnesota, we have to hold the House for progressives and win two. We did win 2 special elections for the Senate. Working on campaigns is a great opportunity to build relationships with candidates and office holders, and position yourself as an honest broker for information on health policy and fixing how we pay for healthcare. So we once you knock on doors for a candidate, they remember you, guaranteed. So that helps us a lot. And then we just build on that throughout the year, and especially on our lobby day coming up. It'll be March 10th, 2026. Upcoming events on our calendar. We hold quarterly meetings for anyone who is able to sign in, and they are virtual. There is a One Pair States National Conference in Denver, August 1st and 2nd, if anyone considers going. It's I happen to be on the planning committee, and it is jam-packed with speakers and topics that are extremely important for states to work on, to get state-based plans in place. So got the Pride Festival here. If you want to check out that event, though, in coming up in Denver, you check the July Healthcare for All Minnesota newsletter in your inbox. We'll have more information coming out. There will also be a virtual option. You know, there is a registration fee, but you will be able to attend that virtually. July 17th is a National Day of Action. I don't know of specific events, but there will be stuff going on all around the state, just like we've been experiencing since January, by the big organizations, Indivisible, 5051, and People's March. So I would say just watch those sites or get on their mailing lists to find out what's going on in your particular part of the state. That July 17th, it is a Thursday, but that is John Lewis's birthday. So the theme is Get Into Good Trouble. We have the Minnesota State Fair coming up. There are sometimes other events for tabling, and I know Duluth and Mankato, we have good volunteers in Duluth and Mankato, and their Pride festivals are different dates. I think September for those 2 areas. So they are doing great work at staffing events like that. And then there's parades and picnics, and our organizing and base building committee is looking for events that we can both speak and table. If any of you have ideas, please let me know, and we'll see if we can support or staff them or provide speakers and or provide people to table and just interact and build more support. The state fair is coming up August 21st to September 1st. This is either our 4th or 5th year where we will have a booth in the education building at the fair. 12 days at the Great Minnesota Get Together. We staff the booth 12 hours a day for 12 days. It takes a lot of volunteers. So keep that in mind and contact me. It's after we get through the Pride Festival, we start thinking about staffing that booth at the fair. And then let's see, our next quarterly meeting is Thursday, September 25th. And I think I already talked about speaker events. And you can just check the calendar on our website also if you want to know if we've got events sponsored by Healthcare for All Minnesota. Physicians for a National Health Program, you are welcome to get on the mailing list for Physicians for a National Health Program also, and also join their national organization, which I have had membership for several years. They send out really excellent newsletters with tons of good information. So, let's see. Then our Legislative and Policy Committee is working on a couple of initiatives that to encourage people to be more involved with their legislators and push for the Minnesota Health Plan. So Dave Garibaldi and Don Pilkinen are co-chairs of our legislative and policy committees. Hey, Dave, you're on. Did you want to say anything about these two projects?
I will say, heard a lot of stuff. And I'm going to make a pitch to you that what you're looking at right here, probably the most important thing that this organization is right now. For the last 7 years, as I have, I'm sorry if I'm breaking up, my internet looks funny, but for the last 7 years, as I have been tabling, I repeatedly get people that are interested in doing something, asking me what they can do. And most of the time it was just, okay, sign up with Healthcare for All Minnesota, start coming to our online events and learn so that you can talk to your family and friends about this, because we have to get everybody on board with this and knowledgeable so they don't take the bait on the propaganda that is being pushed out by the insurance companies and pharma and the rest. Well, what we have here is the rubber hitting the road, because this plan, what we found out this past year is we absolutely have to get our legislators on board and in lockstep with what we're thinking and doing. Otherwise, we are never going to get single payer in the state. We had so much stuff going on this past session that indicated to us that our legislators were just not working with us. So this program that you see here, it's a letter sending program so that we can start our constituents, and we started with lobby day, people want to expand that so that we have people in all 67 districts on board with sending these letters. Typically, Kip Sullivan, who you know is a wizard on this stuff, very steeped in the policy, is producing these letters, and there's a group of us that are also have been put into them. But the main thing is, we have got to get these letters into the inboxes for our legislators, or they are worthless. And we have got to start waking up these legislators that what has been going on for 40 years is no longer acceptable. We can't let DHS and the Department of Health and Commerce be buddy-buddy with the insurance companies and just wink, wink, nod, nod, yeah, we'll just keep doing the same old thing. Nobody will care. That's what's been going on. And honest to God, when I see the stuff that Kip and Buddy communicate on concerning what happened in the 90s and what happened in the 2000s and right up to this date, it's just, it's extraordinary. It's mind-boggling what has happened under Democrats and Republicans. It is so much coziness going on with the agencies and the insurance companies in particular, Chamber of Commerce. This is what we've got to overcome that. We don't have, as it says, we don't have lobbyists to sit on what's going on at the Capitol 24/7, shadow these legislators, whisper in their ears. And believe me, that is exactly what happened this past session, as we had some of our best allies just go renegade and get fear-mongered by these lobbyists. And they took the bait, came up with their own bills, didn't contact Tina Liebling, didn't contact John Marty and run this stuff by them. And we ended up with a cluster. And we can't let that happen. Not if we want to pass this thing according to the campaign plan that we came up with this past year that said by 2028, 2029, we want this enacted. So my purpose here is to just tell you that we have got to get people on this list and involved in doing these letters. We are literally at the point, Bahia is on here. We talked to her the other day. We can use our Every Action platform to literally get this down to a few quick clicks, literally seconds for people to send another letter. And we're going to have I'm going to these legislators in these next 6 months. They are going to read some stuff that is going to blow their minds and hopefully wake them up. So that's what I wanted to say tonight is, honest to God, this is big stuff right here. And if you don't take anything else away, I would say we've got to get people at the Pride Festival and at the State Fair to get on board with doing this. If they, not everybody that you talk to is going to want to do anything, but this is a real simple thing, literally a few seconds a month would really make a difference. And what we've heard from Mark Lebo, who happens to be married to labeling, is that a few emails from constituents on a single topic can really have some weight. And that's what I wanted to tell you about this project. So thanks for letting me talk, Ann.
Yeah, thank you, Dave. We have a lot of very smart policy people working with Healthcare for All Minnesota, with Physicians for a National Health Program, with the one-payer states, and we have lots of information for you. You don't have to make anything up on your own. Not all legislators have a good background in health policy, even if they say they're with us. We need to give them more information and have them be more well-versed so that when they get opposition, they can counter it with facts. And we are working on prepping them. Not everybody's on a health policy committee, so they know stuff about the committees that they're interested in, whether it's ag or housing or tax policy. Our thing is health policy. And so we want everybody to be really well prepared. And we've got lots of information to share with you. So, Bahia, you've got a comment.
Yes, just to let you know, we've had a couple people hop off. So
Okay.
I can share the recording right away. If anybody, I know we're a bit past time, but we are recording this. So we'll share this right out to the email list right afterwards.
Okay.
Any portion people missed.
It's only not even 7:45. I think I'm doing okay. So the second part of the Legislative and Policy Committee is working on is this is literally what we've got prepared for people to send, and you can personalize it and use it for your particular legislators. And that this is tailored to the circumstances right now, with cuts to Medicaid on the horizon. But as things change, as circumstances change, we'll obviously come up with different kinds of information. And honestly, it's, get a lot of people to it isn't even as much as often the actual details, as just keeping after them and staying engaged and making sure they know what you care about. So
Right. This was the first letter, by the way, and we already have another one in the can that's waiting to be sent out. We're thinking possibly even next week sending letter number 2. That is also the topic is also this Medicaid cuts. We think we've got to hit this while it's on the front burner and start getting our legislators interested in the idea that if you get the insurance companies out of our state programs, you might be able to offset these humongous cuts that are coming from the federal government. So they should be interested in this.
the most important piece of legislation that we're going to be supporting during the 2026 session, and this is ahead of actually really hitting the Minnesota Health Fund hard, is going to be a bill that would remove the commercial health insurance middlemen from our public health care coverage programs, which are medical assistance and Minnesota Care. It will reduce administrative costs. It will pay hospitals and doctors directly for services provided. The patient-centered care portion of the bill offers funds for providers for coordinating patient care, the extra time and effort they have to spend for the chronic complex patients in their patient population, and those with significant clinical and social problems. So that's the piece to understand about that. So I can make the economic case for healthcare all day long, but June is Pride Month, and we also just observed Juneteenth, which is the African American Independence Day, reminding us of the horrors of chattel slavery. This message is from Martin Luther King Jr.'s letter from Birmingham jail in 1963. It's just never been more the case that we are all in this together. Whatever affects one of us affects all of us. The rest of the slides are mostly a lot of resources for you, information to learn more about it. The more you know, the more comfortable you are talking about this pretty complex issue. I will not minimize. All of us who've been working on this for many years have learned and have gotten better at talking about this issue. The more we learn, the more we read, the better we get. We are working to educate, organize, and legislate for reform, but the most important thing you can do is become as well informed as you can be about cost, quality, and access to healthcare under our current system, the proposals for change, so that you feel confident to have the conversation and advocate for change. We're not alone. These are some of the organizations have been working on this for years. In Minnesota, we are building a coalition of organizations to push for the Minnesota Health Plan. That includes labor, faith-based, just issues organizations, small business groups, those kind of groups. Sure, Bahia.
Oh, just a question about Senator Marty's book. I
Mhm.
know you mentioned that you have some copies, and if people are interested in learning more,
Mhm.
they can pay, I guess, a nominal fee to read it. But I was wondering, are we passing out any information about Senator Marty's book at Pride Fest? It's such a valuable read, so I wasn't sure
Mhm.
if this has
Yeah.
been a conversation.
Yeah, I'll have copies. If like I said, if people feel that they can really let them go. I have got copies of the book in my car, lots of copies in my garage. I ask people for $10 when we're not at a place where we're not supposed to be exchanging any money. But like I said, I'll bring a few copies, and if you feel that somebody's really gonna actually read it, it's also available on the website, the MN Health Plan website. So if people don't want to have a physical copy or carry something around, they can go to the website. And these are websites for a lot of really useful national organizations who've been on this subject for a long time, including National Nurses United, PNHP, Public Citizen, Social Security Works, Labor Campaign for a Single Payer. Our chair of Healthcare for All Minnesota is also the national coordinator for the Labor Campaign for Single Payer. So we are working really hard at getting labor with us. A business initiative for health policy, One Payer States, like I said, is that consortium of state-based groups, and then Wendell Potter's Center for Health and Democracy. So, John, did you have a comment?
Well, after you're done, I just want to say one thing.
Okay. And again, more websites. And I've got our website and our PNHP Minnesota website. Fix It Healthcare has really great videos that you can, if you don't feel comfortable explaining this mess, show people a 40-minute video and it'll really be obvious. And it's right on their website. Let's see. Healthcare Uncovered is a newsletter that I encourage everybody to subscribe to. It's free. You can make a contribution. Incredibly good information. He is especially on this insurance industry and the pharmaceutical industry. Every week or every 2 weeks, it's a new unbelievable story about what's going on the for-profit side of this system. And then Health Justice Monitor is also an excellent newsletter. Okay, almost done. Yay. Any questions? And John, maybe you want to make your comment here.
Yeah, Thanks, Ann. I've been at this for a few years and I learned a lot. So thank you. And I'm particularly impressed with Dave's passion. And this is what we need. One thing I wanted to point out is that if a patient gets their health care coverage from their employer, the money that that employer pays for insurance actually belongs to the patient. And that is their money. And that then will be available to be redistributed when we get Minnesota health care. Part of that money that they pay to the insurance companies will go into the center that provides the money to be paid to hospitals and physicians. But previous studies have shown that the amount that the companies pay per employee will be less than they currently now pay for insurance. And that
Sure.
difference actually can come back to the employee because that's their money.
Well, and employer-sponsored insurance has been responsible for wage stagnation, significant wage stagnation.
yeah,
Because
exactly.
employers budget on a per hour basis per employee, and as the cost of healthcare goes up, the cost of their wages stagnate, which
Right.
I don't think people. This is not a gimme. It's actually part of their compensation. Absolutely.
Yeah.
Any other questions or comments from people on this call?
That what you said especially affects the people in moderate income people. You know,
Mhm.
when you get to the bottom and people on Medicaid, I've talked to many people that say, I'm on Medicaid and it's just wonderful. Well, yeah. Yeah, and they're not stuck paying through the nose like the rest. Though the argument I do hear from people on Medicaid is that they're approaching that threshold where if they get a quarter more an hour, they're going to get bumped off. Then they're really fearful. And this thing is
Right.
just, you know, what we're doing
Right.
now is just the opposite of what we need to be doing by having all of these cliffs for people to fall off.
Right.
And yeah.
Medicaid and Minnesota Care to an extent keep people in poverty.
Yeah.
Yeah.
And I've had a lot of young people say, I can't make more money. You know, I can't afford to go off Medicaid. So their economic opportunities are severely limited. If you are a young person with a chronic respiratory problem and you need an inhaler that costs several $100s a month, or if you're diabetic, as everybody knows, you cannot not have that coverage for your chronic condition. And you're severely limited in the amount of money you can make. So think of how much that holds people back. Also, small business owners have told us that if we could lift the burden of insurance coverage, whether they're trying to cover their employees or not, or just their family, they would be more likely to expand.
Yep.
And we're also trying to help people understand what's the downside of Advantage plans and what that's doing to our Medicare system. So got lots and lots of information to share. Now I will say that you're probably only going to have a few minutes with each person. So I'm not expecting that you're going to give them a health policy lecture at the Pride Festival. We're going to try to get some information in their hands. We're going to try to get them to give us their contact information and then encourage them to continue to, to engage with us. So I am responsible for building our base of individual supporters and reaching out to individuals around the state. We're, like I said, interested in hearing about any events that you think we should be part of. We've got another committee for coalition building, and then we actually have started to move toward the Minnesota Health Plan with a steering committee made up of members of these different organizations that we've are working to build a coalition with. So Rose Roach is our chair of Healthcare for All Minnesota, and also she is heading up that steering committee until they choose a leader as we go forward. So thank you for joining us this evening for this training and for volunteering for the 2025 Twin Cities Pride Festival. I want you to have fun, and I will see you this weekend. Any comments, last comments? Here, I'll take these down.